Hi, and welcome to the informational video webinar series on the rules for certified school-age childcare centers. This is video number 4, covering staff's, children's, and program records and parental permissions. My name is Christina Christian. I work for the Office of Childcare as a regional manager in the Tualatin Field Office. The Office of Childcare hopes that you will find these videos helpful in learning about the new certified school-age childcare rules. In this series of videos, we will share some of the highlights of the changes and new rules in the School-Age Center rule set. The rules have been organized differently to help make information easier to find. We will also be explaining some of the key features and how the rules are organized. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the School-Age Center rule book for the full list of requirements and rules. Let's dive in. Staff records and training. A school-age center must maintain current personnel records for each staff in paper or electronic format, which include the following: name, address, and telephone number, job title and duties, dates of first and last days on the job, emergency contact information, evidence of education and qualifying work experience, showing that the person meets the qualifications for the position, and the CBR confirmation letter sent from the Office of Childcare to a school-age center. If a school-age center does not yet have a CBR confirmation letter for staff, a school-age center must have written documentation that the school-age center has verified with the Office of Childcare that the staff is conditionally or actively enrolled in the CBR and that they are linked to the center. The documentation must include the date, time, and name of the Office of Childcare staff member that the school-age center spoke with. Additional items that staff records must include are as follows: current first aid and CPR training certificate, current food handler certification if applicable, driving record and driver's license number and expiration date if the person is to transport children, evidence of participation in an orientation, and a statement signed and dated by the employee showing they have access to the center's policies and the rules for the certification of school-age centers. The statement is something new in the school-age only rule set. On this slide, you can see an image of a document that the Office of Childcare created to help support programs with staff records documentation. Use of this specific form is not required, but you must ensure that staff files, whether stored electronically or in paper format, include all of the requirements as outlined in rule. Orientation and initial training. Orientation. A school-age center must ensure that all staff, including substitutes, receive an orientation within the first 10 days of hire and before staff have unsupervised access to children. The Office of Childcare has created a support tool, a staff orientation document, to help you with documenting a completed staff orientation. Initial training. School-age center initial training includes up to 2 hours of orientation, first aid and pediatric CPR training, food handlers training, Office of Childcare approved training on recognizing and reporting child abuse and neglect, Introduction to Childcare Health and Safety training, and Office of Childcare approved Foundations for Learning training. This is an example of a staff orientation document created by the Office of Child Care. The document does cover all of the requirements for the staff orientation. You are not required to use this specific form, but you must ensure that all items required to be covered in a staff orientation are completed and documented as outlined in rule. Annual training requirements. Annually, each school-age center, program coordinator, or program leader must have at least 15 clock hours of formal training or education related to childcare, of which at least 8 clock hours must be in child development and 1 clock hour must be in health, safety, and nutrition. Substitute program leaders who provide care for 35 hours or more per licensing year at one or more sites operated by the school-age center must complete at least 15 clock hours of annual training or education related to childcare, of which at least 8 clock hours must be in child development and 1 clock hour must be in health, safety, and nutrition. Newly hired school-age center staff that are employed for less than a year will have prorated annual training hours at 1.25 clock hours for each month worked in the current license period. Something new with annual training requirements. Any staff member who works in multiple locations must designate one center for tracking the staff training requirements, including annual training requirements. This will fulfill their annual training requirements for each location. Children's records. A school-age center must obtain enrollment information for each child in paper or electronic format prior to the first day of attendance. This includes the following: the date the child entered care, the name and contact information of the person to be contacted in an emergency if a parent or guardian cannot be reached. Something new, the name and telephone number of the school that a child attends if the child attends a school other than where care is provided. Authorization to obtain emergency medical care and to transport the child for emergency medical treatment. Developmental and health history of any needs that could affect the child's participation in the program. A written care plan for any child must be readily accessible to those caring for the children with chronic health issues or special care needs, such as allergies, previous serious illnesses or injuries, and medications prescribed for continuous long-term use. A new item for children's records is verification that parents or guardians received a copy of the center policies. A school-age center must ensure that all children's records are immediately accessible to program staff during hours of operation for use in an emergency or for children with chronic health issues or special care needs. Another new item for children's records is a school-age center must have the parent or guardian review, update, and sign or initial the enrollment form at least annually. This is an example of a school-age child care enrollment authorization form. The Office of Child Care has created this form to help support school-age only programs and includes all the requirements as outlined in rule. Again, you can choose to use your own forms as long as they contain all of the requirements as outlined in rule for child enrollment. Immunizations. School-age only certified child care centers must comply with Oregon Health Authority's administrative rules on immunization of children. If a child is enrolled in a public or private elementary school, immunizations are not required to be documented by the child care facility. Public and private elementary schools are required to report. Parental permissions. child pickup. A parent or guardian of a child can indicate on their enrollment form additional persons that are authorized to pick up their child. However, there may be times when a child will need to be picked up by someone other than the persons that were indicated on their enrollment forms. The program must have documentation of a parent's or guardian's permission to authorize pickup of someone not listed on their enrollment record. The documentation must include the following information: date and time of permission, period of time the permission is valid, name of the individual providing permission, name of the individual permitted to pick up the child, and name of the center staff receiving the permission. A school-age center must have assigned parent permission prior to transporting a child, prior to a field trip, or prior to another activity away from the immediate neighborhood. Field trip permissions must be specific with dates, times, and locations for each field trip. A school-age center must obtain written permission from parents for children to participate in contracted services such as gymnastics or music, or individualized services like therapeutic or medical services that are not directly operated by the center. The permission form must state that the services are not licensed by the Office of Child Care. Parent permissions regarding medications. Parental permissions also include signed and dated parent permission for each medication prior to administration that also includes whether the medication needs to be refrigerated. For chronic medical conditions, such as when a child uses an inhaler, a school-age center may obtain permission for 12 months or less with specific instructions including when administration is needed. Something new with parent permissions: a school-age center must obtain parent permission for participation in special occasions where food is served. Additionally, another new item is parental permission must be obtained prior to their child being photographed or recorded. Parental permission must also be obtained in advance for a child to leave the facility on their own. A school-age center must have parental permission prior to a high-risk activity, such as swimming, on or off the premises, and share the safety plan with parents. This plan must include minimum ratios for the activity, conditions for the child's participation, such as his or her age and skill levels, special equipment necessary, such as safety helmets or specific clothing, and safety practices followed. If a family is experiencing homelessness and the center is unable to acquire written parental permissions and completed enrollment forms, then these items can be received verbally, when documented by the school-age center, or electronically, such as through a text message or an email. The intent is to support families first. Program records. A school-age center must maintain records that demonstrate compliance with all rules for 2 years following the record's creation, such as parent permissions, attendance records, emergency preparedness drills, and pet vaccinations. A school-age center must maintain staff and children's records for 2 years after termination of employment or care. A school-age center may store records off-site that are older than 1 year, but they must be made available within 48 hours upon request. A school-age center must make all other records available to the Office of Child Care at all times. A school-age center must have at least one staff member on site who can access any records that are stored in paper or electronic formats. A school-age center must keep child and personnel records confidential and only available to personnel as necessary, the individual child's parents, and the Office of Child Care staff. If the program has multiple sites, The provider may keep the official personnel file for individual staff off-site. However, each location must have a paper or electronic file on-site for each person working at that location. The file on site must include the following information: staff qualifications for the position they hold, verification that staff members are currently enrolled in the CBR, and documentation that staff members have completed an orientation, first aid and CPR training, and food handler certifications as appropriate. Program attendance records. A school-age center must maintain the current day's attendance record in paper or electronic format with each group of children. All caregivers must have access to the attendance records to determine which children are in care during their work shift, changes in caregivers, and emergency evacuations. A school-age center's daily child attendance records must include the following: the child's full name and times recorded as children arrive and depart so that the record shows the children in attendance at any given time. If a group of children separates from the larger group to move to another activity, such as going outside, the responsible staff member must have a method to account for the children in the separate group, such as a written list of the children's names. A school-age center must maintain staff attendance records, which include the following: the staff's full name, times of arrival and departure, and group assignment. Electronic records must be portable as to be available for use during an emergency evacuation. If using electronic records, the center must have procedures in place to ensure prompt access, including an on or off-site electronic backup method to ensure access in the event of data loss. Administering medication. Centers must immediately document the administration of any medication, which includes the following: the child's name, medication administered, the date and time when medication was administered, the dosage or amount of medication administered, any side effects exhibited by the child, and the signature of the person who administered the medication. The Office of Child Care does have medication authorization forms available that include all required information. The form was created as a support document for programs. Just ask your licensing specialist if you'd like a copy. A school-age center must have a visitor log to document all adults accessing the facility that are not enrolled in the CBR. The documentation must include the name, the relationship to the center, whether they're a volunteer, vendor, guest, and the recorded time in and out at the center. This excludes persons that are authorized to drop off and pick up a child. A school-age center must maintain records regarding emergency preparedness and fire prevention, such as dates of drills for at least 2 years. A school-age center must have parents or guardians of each child enrolled in the center sign a declaration form approved by the Office of Child Care, verifying they have reviewed a copy of the current license certificate. The declaration shall be updated anytime an exception or condition is added to or removed from the license. Thank you for watching. You can now move on to video 5 in the series.